I'm very glad to be here this morning with the Police Commissioner, who of course is the State Coordinator, the Chief Public Health Officer, the Chief Executive of Health, and I can also confirm to the people of South Australia today that Mr Chris Picton on Thursday will be sworn in as the new Health Minister here in the state of South Australia. What I'd like to do is just provide a bit of information regarding some actions that I can commit to in respect to my government, and then go into a bit of detail about what you're all likely to be here to hear about, and that of course is my government's COVID management approach. On Thursday morning at 10 a.m. at Government House, I can confirm that the remainder of the Malinauskas Labor government cabinet will be sworn in. We've been working incredibly hard, of course, over the last 48 hours or thereabouts to ensure that that's the best cabinet that my government can offer the people of South Australia to realise our policy ambition. As I've stated previously, and I'm happy to reiterate today, there will be some changes. They won't be major, but there will be some changes to both portfolios and personnel. But I can confirm that Chris Picton will be the new Minister for Health and Wellbeing. In regards to COVID, as you are well aware, yesterday I enjoyed an incredibly productive and important meeting with the Chief Public Health Officer and the State Coordinator regarding COVID management in the state of South Australia. It was fantastic to be able to have a very thorough briefing, but more importantly, it was an important opportunity for me to fully scrutinise the decisions that have been made up until this point, but more importantly, what has informed those decisions. The simple fact is that in South Australia we do have a degree of inconsistency with the vast bulk of the Australian population in a range of policy settings, the most topical of which, of course, are mask wearing, but also isolation and quarantine requirements, particularly quarantine requirements. My government does have an ambition to get closer to national consistency in that regard. I think that is good for the people of our state, I think that is good for our economy, and I think that is also good for our nation as a whole. National consistency should be something that we all gravitate towards as we move through new phases of COVID-19. Now, all of that, of course, is subject to what happens with COVID in respect to new variants and the like. That is a precondition for every statement that we make, that if, of course, something changes in respect to a new variant, then, of course, the policy settings will necessarily have to respond. But for as long as all things are remaining equal, the national consistency is something that we should be working towards. I made that ambition and desire very clear to the State Coordinator yesterday, who I would like to acknowledge his very substantial service. Now, the role of State Coordinator is an incredibly complicated one during a very complicated time, and I think the Police Commissioner has shown all the hallmarks of outstanding leadership over the course of the last 2 years, and I think that's particularly appropriate to acknowledge today, given that it is the second anniversary of the Emergency Management Declaration being in place, a topic that I'll come back to in a moment. But I also do want to thank the Chief Public Health Officer for her leadership and her sage advice throughout the entirety of the pandemic. Our state has been served well from it. Both those individuals working together in a collaborative way has served the interests of the South Australian people, and that is something that I very much look forward to being maintained in my government. But I think a new government does provide the opportunity for a fresh set of eyes and a new approach, and I can announce some actions that my government will be taking effective immediately. In fact, they're already in place as a result of the meetings I had last night and in a subsequent meeting this morning. First and foremost is that there will be a change to policy and process in respect to COVID management in the state of South Australia under my leadership. I can announce today that the COVID Ready Committee is being abandoned and it is being replaced with a subcommittee of Cabinet. That subcommittee is the Emergency Management Council. Now, the Emergency Management Council, for your benefit, has been in place for some time. It is an existing subcommittee of Cabinet that was in place under the Marshall government and, of course, under the former Labor government before that. It is a staple as far as subcommittees of Cabinet is concerned. But I do want to see Cabinet play a more substantial role in ensuring that the meetings we're having are actually resulting in actions that can be delivered by the government. And, of course, those actions will help furnish the state coordinator with as many options as we reasonably can in the decisions that he makes when it comes to COVID management. When it comes to the legal authorities that are in place around things such as isolation requirements and mask wearing, that will be, of course, maintained through the Emergency Management Declaration. But the actions the government takes informs the decisions that the state coordinator makes. And I want to give the state coordinator as many options as possible to see us reach that national consistency as quickly as possible. As quickly as possible. So, as I mentioned earlier, my new cabinet is being sworn in on Thursday, and then at 9 a.m. on Friday morning, the Emergency Management Committee, or Council, will meet, that subcommittee of the Cabinet. And then that subcommittee of Cabinet will have the authority and the power to be able to issue instructions to the government effective immediately to ensure that actions happen immediately. If I can speak more plainly, the COVID Ready Committee is not a decision-making body. It does not have true power. It doesn't have any specific authority invested in it. And I don't want to chair a committee that doesn't make decisions. The people of South Australia elect a Premier to make decisions, and I seek to chair meetings that make decisions. And of course, when the Premier chairs a meeting of Cabinet or a subcommittee of Cabinet, then it has authorities that can actually deliver upon actions, hence that policy change. I can also make it clear that following our meeting of EMC on Friday morning, then on Friday afternoon, we will have more announcements potentially to make regarding to COVID outcomes. They, of course, may relate to decisions that the state coordinator has or has not made. But what we're seeking to achieve here is a set of actions that gives the state coordinator as many options as possible to try and achieve national consistency where we can in a safe way. Now, I just want to go through some other directions that I've issued my government, and then we can hear from the Chief Public Health Officer. So, I have directed SA Health to rapidly develop a plan for urgent additional hospital preparedness in preparation of rises in COVID cases. The Chief Public Health Officer in a moment will share with you the most up-to-date modelling that we have available to us, which I understand has been updated as recently as last night. What you will see in that modelling is that case numbers, even with current policy settings, are set to escalate in a rather significant way. This is modelling that I understand has been in possession of the government for some time. It's been updated last night, and I want to make that publicly available to the people of South Australia today. It's an important act of transparency. I think South Australians are entitled to know where we're at. People would have seen case numbers go up. That looks as though it may be continuing in the very near future. And the Chief Public Health Officer can go through that, but also what the implications of that are in respect to hospitalisations, which is, of course, the key number. But upon examination of why it is that South Australia doesn't have a nationally consistent position on things like quarantine requirements, my suspicions that I enunciated as leader of the opposition have proven to be true, in that the reason why we have tough restrictions is because our hospital system is under extraordinary strain. I have been formally advised by the Chief Executive Officer of Health that last week was one of the toughest weeks that South Australia has ever experienced in respect to hospital pressure. There is a lot of demand on hospital capacity at the moment. So much so that I can reveal today that on Friday last week, a decision was taken to ban all non-urgent overnight elective surgery in our public hospitals. Let me say that again. This is an important point. On Friday last week, a decision was taken to ban reinstate a ban on all non-urgent elective surgery, overnight elective surgery in public hospitals. So things are so bad in our public hospital system that the elective surgeries that were put back on are being cancelled again. So if you want to know why we've got different arrangements in South Australia for isolation requirements, that has been an informing consideration that no doubt has helped inform the judgment of the state coordinator in making relative decisions. Now, I want to be upfront and honest about that. Make no mistake, our hospital system is under extraordinary strain. It doesn't necessarily enjoy as much capacity as I would like to see in place, hence our policy to dramatically increase hospital capacity over the coming 4 years. But obviously we can't click our fingers and make sure that happens overnight. But you need to be aware about the state of the situation and why this is the case. Needless to say that I was rather disappointed and somewhat shocked to learn that an elective surgery ban has now been reinstated in some instances here in South Australia. That is significant news. So as a consequence, and upon hearing that information, I have directed SA Health to rapidly plan for urgent additional hospital preparedness, particularly given there is the prospect of COVID cases continuing to rise. I've also directed SA Health and the Department of Premier and Cabinet to develop a campaign all orientated at increasing the take-up of the booster here in South Australia. And as the Chief Public Health Officer will explain, increasing booster rates matters. If we can increase booster rates, that will give the Police Commissioner or the State Coordinator more ability to mitigate restrictions. And we are going to ensure that my government does everything we can to increase those booster rates, including looking at substantial campaigns run by the government. Now, I don't see much value in plastering trams with telling people that the government's building what matters. I do see value in making sure there is strong public messaging about the benefit of the booster take-up. And if we can get that message out there in a stronger and more powerful way, even if we have a plan to do that, that will aid the State Coordinator in their efforts. The Emergency Management Declaration. It is my government's desire to see an end to the rollover of the Emergency Management Declaration every 28 days. The time for the Emergency Management Declaration continuing to be rolled over and over and over is coming to an end. It is my government's ambition to ensure that we don't see an extension to the Emergency Management Declaration beyond 30 June. And I've conveyed those wishes to the Police Commissioner. It is my desire that it conclude even earlier than that. And that may be achievable if the government does everything we possibly can to give the State Coordinator more options. So ultimately, of course, it is the State Coordinator who makes a judgment about whether or not an extension should be requested, but it is my Cabinet's job to approve whether or not an extension is granted. And both the State Coordinator and I have a common goal, have a common ambition to no longer see that emergency declaration continue to roll over and roll over and roll over. So we would like that practice to have stopped by the 30th of June, and if we can do that sooner, all the better. One of the things that will inform whether or not the Police Commissioner asks for an extension to the Emergency Management Declaration or not is the legal framework that replaces it. Now, look, this is not the only consideration, but it is a consideration. And on that basis, yesterday evening, I instructed Crown Solicitor's Office to immediately undertake a piece of work to look at the legislative change that may be required to make the Public Health Act more functional in the context of the pandemic. By making changes to the Public Health Act, that may minimise the need for the Emergency Management Declaration being rolled over into the future. In fact, even the prospect of changes to the Public Health Act may give the Police Commissioner more options in terms of that Emergency Management Declaration. So last night I instructed Crown to immediately start commencing that work, and I'm very grateful for them doing that as expeditiously as possible. If that piece of work does recommend changes to the Public Health Act, and of course I should mention that the Crown is working with SA Health in that endeavour, and I thank the Chief Executive Officer of Health in facilitating that exercise. But should the Crown, along with SA Health, recommend changes to the Public Health Act, then it is my intention to bring those to Parliament as quickly as possible. And if we can get that legislation, if indeed it is required, if we can get that legislation through the Parliament, even better again. But we do need to evolve here. We do need to move quickly. We do need to see a situation where the Emergency Management Declaration is no longer required. We are going to do everything we can to make sure that happens as quickly as possible. And finally, the top line point again, I've asked SA Health to also examine all options to expedite national consistency in South Australia regarding isolation and quarantine. The EMC meeting on Friday will examine that particularly. The top line order of business at our meeting on Friday morning will be to examine what can be done, what will be done in regards to isolation and quarantine arrangements, and that of course will help aid the State Coordinator in the decisions that he chooses to make or not to make.